There was no public participation. There was no following of the procurement rules. We have procurement and disposal act, which was not followed. You cannot single source a service provider when you are talking about billions of shillings. Therefore, Mr. President, we want to ask you, how can you allow one person or two people to take 104.8 billion out of 148 billion, and then you leave Kenyans with 45 billion? Out of the 45 billions you are leaving for Kenyans, 15 billions will go for administration. So the entire about 60 million Kenyans will be left with only about 30 billion to provide of the provision of those services. It is a shame. It is like they are vomiting on our feet. They are spitting on us. The robbery is too much, and we are embarrassed. I am embarrassed. If the president can allow that to happen, then I'm embarrassed with this government. That must stop. We only needed 700 million to upgrade the current NHIF system to bring whatever they had added in shift. So why do you call for a new system when the one which is there has not failed? It's just a way of corruption. It's a way of wanting to steal from Kenyans, but the stealing they want to do in this shift, it is a stealing that even a small child of 2 years cannot accept. We urge the president to intervene. We urge him to tell the procurement people to follow the right channel in the procurement, and the old system of NHIF should be upgraded. Because the money has not yet been collected. Remember, this month will be the first month they are deducting us. So, but we don't want them to deduct us our money and then they can't steal the whole of it. It's shameful that 1 or 2, 3 people can take 95% of the money meant to give healthcare services to Kenyan people. We are solidly behind the industrial action that's going to come. We want it to happen. We can't sit back and watch somebody stealing from us, robbing us daytime. And because we have nothing to do, they have already said they're going to steal the money. We cannot allow that. We can't. That one we cannot accept. It is obvious that we are going to lead Kenyans in a massive industrial action against the theft that's going on. But I want to be very clear. SHA, what was proposed to be offered to Kenyans is way superior than NHIF. But it's not being funded because money is going to 2 or 3 people. So the problem in this shift and SHA is corruption. But the entire program is good. If I'm in Nairobi and my relative is sick at home, I should be told has gone to hospital, is being treated. I should not be told bring money, ya kununua dawa, ya kununua nini. But if this thing continue, we'll still continue the problem that we've been having. Right now, mothers are not being allowed to give birth. If you don't have money, you cannot be treated. You know, how do you talk of universal health coverage when you're denying people services? They even say they wanted, if you have not registered with that SHIF and SHA, you cannot be treated anywhere in Kenya. So what kind of medical cover is that? So we want them to improve on NHIF. We don't want them to bring new things. Then when you go up, it was clearly subsidized. But when you look at the services being given today, you're asking a pregnant mother from the village to go and pay. Where do you expect to get this money? Even the county governments were running programs like the one Oparanya used to run. Oparanya Care, where mothers will give birth and they're given 2,000 and they give birth for free, and they're given some money as a follow-up so that they can go for postnatal care. The county governments are not getting the money. They can't run programs. Where is this money hiding? Who is eating this money that's supposed to go to the county governments? County governments, it's true, they are collapsing. They do not have the money. So the problem we have is enormous. Where has that money gone? Where has that Linda Mama gone? Where has the money gone? The afya for the children in high school, where has it gone? The only thing we see is they want to get more, reduce what we have, and it's a shame. I said from the beginning, it's shameful, and Kenyans must rise. If there is something that we call upon Kenyans to rise, it is this one. When we go on strike, we want the entire nation to go on strike, because there is no way you have taken away money that was meant for Linda Mama, imeenda. Money meant for education for high school children, imeenda. And then we are taking us more money to give this wife. We can't allow that. And I'm saying this without fear of contradiction. So the only thing that I want Gachagua to go home is tribalism. Gachagua cannot be the second in command, who is supposed to be the debut symbol of national unity. And every time he wakes up, he talks about Murima. Sisi mimi nimeoa Sendro, pipi wawili. Anataka watoto wangu wasipate kitu kwa sababu asiishi Murima. I agree with the impeachment of the David president on account of tribalism. But those other counts to me are a null and void. Null and void, because when everybody, look, yesterday the David president fixed himself. He said that he has been given many cows until he's now the largest farmer of dairy farms you were. Do you know that the law governing public service says if you are given a present of more than 20,000, you are supposed to declare the rest? So has he declared? One cow costs for over 150,000 ya daily. So kama amepewa ng'ombe paka amekuwa mkulima mkubwa, inamaanisha he's holding government property and he should be asked to return. EACC should now land on him to return those cows so that they value them. Then they give you 20,000 for each cow. Then the rest of the cows go to the government. That's government property.